Great. Okay, look, just very quickly, aspirin and warfarin, what's best? That's a really difficult question. It's a question that's vexed us over the years. We've got some information from the registry that may be helpful in that regard. But I guess in summary, as you've already heard, there's not much evidence. There's 2 studies that show there's a risk of thromboembolism or clot in patients who have Fontan, but they don't show one method, aspirin or warfarin, as necessarily being better than another. But neither of those studies is perfect. The first study is the study that Chantel's told you about, had a fairly small number of patients. You might think 50 or 60 is quite a lot in the aspirin and in the warfarin arm. But actually, when you're looking at kids over a couple of years, over a limited period of time, it's not a lot of time for things to happen. In those studies, there were about the same number of clots in the aspirin group as the warfarin group. Over 2 years, there were 3 important clots in the aspirin group and 4 important clots in the warfarin group. So this is not a common thing to happen, but it does happen even over just a couple of years and even when you're on medication. So the complications rates were similar, small numbers, short follow-up, just a couple of years, and just in kids. We're not talking about adults with a Fontan circulation here, we're talking about children. Second study was from our registry, so therefore it must be good, big tick for that. Larger number of patients. Wasn't randomised, we just looked at everybody in Australia and New Zealand. Some people were on aspirin and some people were on warfarin. As we've already heard, Melbourne tends to use warfarin, Auckland tends to use warfarin, Sydney and Brisbane don't tend to use warfarin, they tend to use aspirin. So we thought, well, we've got one group that's been doing things one way and another group that's been doing things another way, let's just have a look and see what happens. The problem is that there are other biases within those institutions. People in Sydney did things different to people in Auckland, etc., etc. So the patient groups weren't absolutely comparable, and that's where the problem is with this information. It was also retrospective, so that means that we looked back to see what had happened. So we're reliant on cardiologists reporting information and patient records that we could review. And that's not a very good way to look for clots, to be honest. So it's probably under-reporting. And the most secure data we had was within 10 years of the Fontan. So again, we're not really talking about adults here, we're talking more about kids, because, you know, the average age at a Fontan is about 3 or 4 in Australasia, so we're talking to people in the first sort of 3 to 4 to 14, 15 years of age. I think I've covered this. I guess the bottom line is that those on warfarin tended to have more severe heart problems. They tended to have more severe forms of things that you need a Fontan operation for. About 300 on warfarin, so most people in Australasia, I guess the majority were on warfarin, 150 something on aspirin, and a few taking nothing. And you can see there in that graph that the rates of thrombosis over 10 years, 4% in warfarin and about the same in aspirin, really no different. But just remember that the patients on the warfarin tended to be patients who were a bit more at risk maybe of having thrombosis. So even though the people in New South Wales didn't tend to use warfarin, if they were worried then they would use warfarin. So that's the sort of bias that I'm talking about. Okay, so if we look 1 year out from the Fontan and then 10 years forwards, there were 15 clot events. 9 were detected with routine screening, like an echocardiogram where some thrombus was seen, but they didn't actually cause any trouble. So there were 6 that caused trouble that came to light because somebody presented not very well. And of those, there were some strokes, of which fortunately 3 were transient. So, you know, thinking 10 years, that's maybe 6 or 8 events that were serious. There were 12 serious bleeding events, and 11 of those were on warfarin, and 4 of them were on warfarin where the test was higher than it should be. So, you know, if you're taking warfarin, you check your INR, you test, and so about 1/3 of those bleeding events happened when the blood test was higher than it should have been. which means 2/3 happened when it was within the range expected. So what do we know? Clot problems occur in the Fontan circulation. Aspirin and warfarin probably help to prevent some of these, but they aren't a complete answer. There doesn't seem to be a big advantage of one over the other in the average patient. And I put that in italics because I think that's probably the key issue. There are people who are at higher risk of thrombosis. And in those patients, I think most people would agree that they should be on warfarin. It's the ones who are at a lower risk where I think we just have to be honest and say, look, we don't really know. Studies so far have looked at children. Grown-ups are different. As we get older, we start to do a bit less. You know, some of us put on a bit of weight and stuff and what have you, and we tend to be a little bit less active and therefore more at risk. Even if we don't have a Fontan circulation, we're more at risk of thrombosis and clot formation. So grown-ups may well be different, and there's a whole different issue there that we don't know very much about at all. However, in kids, some kids may be okay on aspirin rather than warfarin, especially if they don't have a lot of risk factors. And I'm just going to leave it at that and take some questions if we've got some time. I don't know, Eva, you